All right, so we are back on. So as I was saying, one of the reasons why we're having issues with COVID-19 in African Americans is related to housing. So the general treatment for someone who is exposed is to stay away from people, but how do you isolate yourself if you have 6 people in a 2-bedroom house? What I was saying was that 50% of African Americans pay 1/3 or more of their income in housing. So we have less positive housing. We're more likely to live in an area. 70% of African Americans live within 30 miles of an area that has been designated as poor air quality. That leads to lung disease when it is a lung disease, COVID-19. Racism. So it's out there. I mean, the George Floyd case has shown a spotlight on racism. But with the National Medical Association, we have known for decades that racism in and of itself leads to poor outcomes. When you factor out the social determinants of health like housing, insurance, education, income, African Americans still have worse outcomes. So the one variable is racism. A Black person gets worse care than a white person, even if they're identical in all other manners. So where are we now? We are at the point that this country is starting to reopen. So I would say that you all as realtors need to be very wary of this. I spoke with your leadership and the statement was, and the position is you are now having open houses and there is the business. I would say that do understand that the virus did not go away and therefore do your business, but keep your infection control procedures up. Wash your hands, wear a mask at all times, cover your cough, wipe down surfaces. If anyone is sick, quite frankly, I probably would not let them in an open house. And if anyone of you all are sick, the realtists, the developers, the mortgage loan brokers, all those that are associated with the National Association of Real Estate Brokers, take care of yourselves and your family. If you're sick, don't work, stay away from others. You all are guardians of the community, and we appreciate that. We have to take care of ourselves. The NMA, our mission is to take care of and respect and advocate for African American physicians. But what makes us different than the AMA is we also advocate, respect, and take care of the African American community. So we have a mission and a drive that aligns perfectly with yours. So one or two other things, and I would like to open it up for some questions. The effect. So we're seeing a psychosocial, emotional effect from COVID-19. People are sheltered in place. They can't see their grandchildren, can't go to church, they can't go out to a restaurant. And so we're seeing more child abuse, domestic violence, more anxiety, more depression. So do you realize in your business you may see effects such as that? Economically, the 45 celebrated last Friday when the unemployment rate went down to, I think it was 16%. That is no reason to celebrate. We have a higher rate of unemployment than the majority community. So we need to understand that. So you all as business people understand that. And when we interact, when we work, we have to look for social justice, but we also need economic justice. And then physically, if we tend to be have these social determinants of health, these issues, these pre-existing conditions. So we need to be very wary of the fact that we are at higher risk. So when you hear, oh, now it's okay to go to a restaurant or a bar, a public event like a concert or venues like a museum, do understand that we are at higher risk for hospitalization and death. So be very wary. If your local department says it's okay to do that, if you're governor, if you're mayor, think for yourself. Use trusted sources of information. One of those can be the National Medical Association. We do not always agree with the recommendations. If you look at the states that opened up, they are now seeing higher daily case rates, hospitalization rates, and death rates. North Carolina, Arizona, and Florida are three prime examples. So they made a decision to open up, and what are they getting? More cases. So I would say that this is a time when we need to be independent of what you may be hearing from government officials, but dependent and involved in the information you're getting from, let's say, the leadership of the National Association of Real Estate Brokers, the NMA, NAACP, and groups like that, the Urban League, because we are all talking to each other like we are now to ensure that we all have the proper information, because this country has a history of misinformation and disinformation, and we know that well. So I would like to pause there to see if there are questions either from the leadership of the Realtists or those that are attendees on this webinar.
Well, Dr. Brooks, I'm going to jump right in here. We hear a lot about home remedies and how we can get a hair dryer and heat up a person and smell orange peels, boiling orange peels, but I need my members. I take my job as president extremely serious. I need them to know, yes or no. Is that a way to go, or what's your recommendation?
Okay, so let's be direct. The answer is generally no. I will say this, that the virus prefers a weak host. So in other words, take care of yourself. The stronger and the more robust you are in terms of your overall health, I believe the less likely you are to have an adverse outcome if you do, in fact, get infected. That being stated, no hair dryer thing, the orange peel, those are not recommended. I will say I do like vitamin D. African Americans, because we have darker skin, have lower levels of vitamin D. Vitamin D seems to act almost more like a hormone than a vitamin. It has a lot of effects in the body. So there is some evidence that supplementation with vitamin D, especially if you're vitamin D deficient with 4,000 units, is helpful for your immune system. In general, the thing to do is the things that we all know. Mask. I have to start with that. That is so important. My daughter is in Texas right now, and she's saying in Texas, a lot of people walk around without masks. So masks protect you from spreading it to someone, but there is some degree of protection for yourself. And N95 protects you from getting it. If you have an N95, that actually is preferable. So I would say eat right, exercise, get your sunlight, get your vitamin D. Stress releases cortisol, which is anti-inflammatory, and that's not good for your system. So try not to be stressed, meditate, get your sleep. Those are the things, if you talk about home remedies, that I would recommend.
Okay, so I need my members to know not to stress me out, and I should and I should get some vitamin D. Thank you very much, sir. Any other questions in the chat, Joe?
Mr. President, I do have a couple of questions I see in the chat. First question is, we know that in many places we flock to the hair salons, barbershops, and nail salons. Is that safe, doctor, if we have a mask on and they have a mask, or because we're more susceptible, should we stay away?
So for me, that is the most difficult question. As you can see from my due, I've been lacking in seeing my barber. So one, I didn't mention obviously, but physical distance, keeping 6 feet away from people. So there is some evidence from the WHO that even with masking, if you're closer than 6 feet, there is the chance of you contracting COVID-19.
Wow.
I look at nail salons as slightly different because, you know, you can reach your hand out. Your general reach is somewhere around 2.5 feet. So this person working on your nails is 2.5 to 3 feet away. When you're getting your hair done, that person is, you know, within a foot or so. That, to me, that does make somewhat of a difference. I would say this: I would be very cautious. You wear a mask. Obviously, you don't want to be, if we're waiting, don't want to be within 6 feet of other people that may be in the same salon. I would probably shorten the time. So if you were, normally it takes you a half hour or 45 minutes to get your hair done, try to do it in 20 minutes. I mean, it's just, I cannot endorse being inside of someone's 6 foot distance for long periods of time. I'm very uncomfortable with that. The virus did not go away. One thing I didn't mention is testing. So we get widespread testing, and we know certain people are tested negative. If you knew the woman in your hair salon that did your hair, and if I knew my barber was negative, now it's only one marker in time. You could be negative today and positive tomorrow, but it's still somewhat reassuring. If we had widespread testing, then that would be more helpful. So I'm going to give qualified stay away for hair salon, barber, a little less discomfort with nail salon, and say that clearly as best you can, shorten the time, wear masks, and as much as reducing exposure to others as you can.
Well, doctor, that is great information that probably no one wanted to hear. What about, is this virus airborne?
Yeah, so you picked the hardest questions, and I appreciate that. So there's droplet versus what's airborne, but there's droplet versus aerosol. So I'm almost worried that they don't want to really tell us that it's aerosol because they don't want us to freak out. So aerosol, it can go out and linger in the air for hours. So you can walk out of a room and those particles are floating in the air for up to 2 hours. Droplet, they're heavier, so they come out and then they kind of drop off. So right now, the feeling is that it is droplet and not aerosol. So if it is in fact aerosol, then that's worse. But right now, I believe that the evidence shows that it is droplets. Obviously, touching, you cough on your hand or you touch your mouth and the virus is in your respiratory tract like your mouth. Then you touch a surface and someone else touches the surface. There is evidence, I will say on the good side, that it spreads less when you're outdoor and it spreads less in the heat. So it doesn't like humidity. So when it's hot and humid, like DC or the South, that seems to be a better environment for us to interact. I'm not saying when it's hot and moist, you can just go out and go to an outdoor party, but that's one of the things that we are determining with the information coming out.
Doctor, we have tons of questions. The next one is, once someone is hospitalized, how can we advocate for the family members and ourselves to get chest scans, care communication with the family, etc.?
Say that, what was the last one? To get what?
It says, once someone is hospitalized, how can we advocate for family members to receive chest scans and so forth? Okay,
so the thing would be to get tested is what I would say. So the main thing is to, is stomp your feet. In other words, that's one thing I've been saying, that we need to advocate for ourselves. There is evidence that African Americans go to the hospital and say, I have fever, cough, shortness of breath, and my wife has COVID and say, oh, you're okay. So we have to advocate for ourselves. Same way you would if they didn't give you a 30% discount with your coupon, okay? So we need to really step up. So that's what I would say. The other thing we need to do is we have to have more African-American healthcare providers, so we take care of our own. So that's honestly, there's no other way. And then to have knowledge, to know that I saw this doctor, this NMA, and he told me that if I've been exposed, if I have fever and shortness of breath, I need a test. And let them argue with you, but you lay out the facts to them. So that's what I would say. And that's a good point. That's very important.
Thank you, Doctor. What is there any information regarding vaccination testing, ETA on that? Are we looking at the end of this year? They're talking in months. Is that unreasonable? Is that too expeditious? What do you think? What are your feelings? Right.
So I've done a lot of work in the vaccine realm. So they are working on a vaccine. There are two that are really, there are 106 clinical trials right now, just so you know. So there are a lot of people working on vaccines. We don't know. I am really hopeful it will be rushed to market. If we do it in this short period of time, vaccines generally take 3 to 5 years to develop. But these are emergency times. I mean, so it's understandable. I would say that if we can get a vaccine, my guess, if I had to really, really look into a crystal ball, I'm going to say March, just because I'm feeling the end of the first quarter of 2021. The ones they're looking at, you can manufacture. What's happening differently with the vaccine, they're looking at manufacturing it even before they know that it truly works. And that's one of the things that delays it. So that's one of the delays that I'm okay with. It's like you guys, painting and redoing the bathroom, even if you don't know that you're going to put the house on the market. I'm just going to do this to increase the value. So I'm guessing March. I believe that there will be some Black involved in the clinical trials. That's one of our concerns also, to ensure that we are part of the testing. So for efficacy and effectiveness of the vaccine. Safety will also be a question.
Right. Great. That's concerning, because when they talk about we may have a vaccine in September, October, and when it normally takes 3 to 5 years. So there's been a lot of conversation in African-American Black communities, like suspicion around that, and people have said they wouldn't want to take it. So we'll be looking to your organization and other organizations when that time arises for leadership on how to move forward with that.
We will have
the
it
next
for you.
question. Thank you. The next question is around travel. What is your recommendation about airline travel over the next 60 days and perhaps beyond?
I am wary of it. You're in a closed space. And again, as I said, outdoors is better than indoors in terms of not getting it. The airlines are working hard to clean down their planes, on the interior. The seating should be 6 feet apart. I would say, and clearly you would mask, I would say if all those provisions are in place, that I would be a conditional, if you have to travel. I would say I'm concerned about traveling for pleasure, but if it's business or if it's, I'll say important, it may not be business, but it may be, you have to go see a relative or there's an event that's really, really important, that take all the proper precautions. And then again, the highest risk are those that are 60 to 65 and older in underlying conditions. So if you're older and you are, ailing, I'm less inclined to recommend travel.
Another hard one for you, Doctor. Thank you. Here we go. Based on your insights, what do you think is a reasonable timeline to even start planning gatherings of 100 or more attendees?
So I'm in a fraternity called Sigma Pi Phi, the Boule, and we literally had a meeting on this on Monday. And we have determined that we are not going to do anything like that until 2021. So right now we're through to the end of the year. I will say this, that this is evolving. So over the summer and going into the early autumn and September, we may have more information. But right now, and for me, it's not even so much the number, but it's the physical distancing. So if you were in a gymnasium, let's say, you might be able to fit more people if you literally spread them out and you have them leave one by one so they're not all on top of each other. They're all masked. Theoretically check their temp on the way in, though 40% of people have no fever that have COVID. So it's more the ability to keep that physical distance than it is the absolute number. But in general, large gatherings, I'm feeling it's going to be not until the end of the year. I hate to say that, but we check on that every month.
Thank you, sir. What about swimming pools? Do you feel that those are safe?
Yeah, I actually do feel swimming pools are safe. The virus is, as you asked, airborne. So you're not going to get it in a pool. It's not going to go in the pool and then go to some. I think once it gets in that water, it's going to dissolve. It's not that stable of a virus. When it gets on the surface, it probably is gone within hours. We still need to wipe down and disinfect surfaces. The issue in a pool for me would be, the physical distancing. So two people that are 10 or 12 feet apart in the pool swimming around, they're not going to get it, in my opinion, from the water. So no, there's no evidence of it being spread in that fashion.
Here's another one. Someone said they have read that you can kill the virus in your own throat in the event that you've been infected by gargling with Listerine.
Yeah, no. I would say that doing something that I wouldn't dissuade you from doing that, but I would say unlikely, because once the virus gets in you, what it does, if you've all seen that picture, there's a little spikes, it enters the cell. So it's not like sitting there on the surface of your throat. Your respiratory epithelium is moist. If you think about it, your nose, inside of your mouth, going all the way down to your lungs. So that moist surface allows it to penetrate into the lining of your respiratory tract. That's why it doesn't go through your skin, for example. But it can go through your eye. So a lot of people, you can get it through your eyes. That's why you have to cover your eyes. It's good. If you travel, I didn't mention that, you should wear sunglasses or something. You get on a plane, absolutely cover your eyes. But no, I don't. Gargling is not going to do it.
Do you recommend that having a humidifier in your home or office is a good idea to prevent
That's
against?
a good question. I would say no, maybe. I mean, there's evidence that it does not like humidity, but I don't believe that that's going to help much, because I'm really concerned. I mean, again, my feeling is if you truly keep that 6 foot distance and you mask, you're pretty good. So it wouldn't hurt. But my concern when we do certain things like that is then people start to get a level of comfort. Oh, I have the humidity up, so now we can get closer than 6 feet or don't have to wear a mask. So I would say it's a consideration, but I'm worried about those things having you let your guard down.
Do you know of we can get some literature that would be available for our membership for best practices that we need to utilize? We can get some literature.
I would right now recommend the CDC.gov. The CDC's information as it relates to which you speak is good. I mean, they still are not giving us good race and ethnic data, and they're still a little bit behind in some of the things that I'm looking at. But for issues as it relates to even going to the point of what do you do for someone that may be depressed, what do you do in terms of interacting in groups, testing, physical distancing, and wiping down surfaces, that type of stuff, type of information, CDC.gov has good information.
Dr. Members of yes.
We have a Facebook question also when you're finished with that question.
I can't hear you. What'd you say?
We have a Facebook question.
Okay. Let me ask this question.
Okay.
Is there a database where we can identify Black doctors in our area that you are aware of?
So the NMA has a link. NMAnet.org is our website, and you can click on Find a Doctor, and takes you to blackdoctor.org, and there is information there, and that is a way. The other way is each major city in every state has a National Medical Association component, like Golden State in California, Charles R. Drew and Laura Lawrence in Los Angeles. So that would be a way. But for right now, I'd say go to the NMA website, nma.net.org.
Okay, Jill, will you type that in the chat box for everybody as well? Thank you. Here's a Facebook question for you, Doctor. Manel Bevels, I heard that depending on how the doctor classifies a patient's need for a COVID-19 test, their insurance may charge thousands of dollars. What's the classification that may minimize the cost? Are the drive-through test sites accurate? That's the second part.
Okay, right. So the drive-through sites generally are accurate based on how they do it. There are three ways to do it when you're testing for the virus itself, as opposed to the blood test, which we're not. I don't have a feeling for. I don't believe in that yet. Swab the nose all the way in the back. Swab the nose just in the front of your nose or in the mouth. And anywhere, generally speaking, if it's done properly, from 94 to 98% sensitivity. So very few false. What would that be? False negatives. So, well, in other words, if it says you have it, then you have it. If it picks it up. As it relates to the other part of the question, the test is not. It's not thousands of dollars. You're being ripped off. The test generally is. They're looking at. We're getting anecdotal evidence of them starting to gouge, but generally the test doesn't cost more than $50. I think in our area it's $52. So what it would be though, in terms of that, I would say you would want to have symptoms. Generally speaking, you should not have, that shouldn't happen. It should be the routine test, and either shouldn't even have to pay for it. But the test clearly would not be in that category if you had symptoms: fever, cough, shortness of breath, exposure. And now, of course, we're looking at sore throat, muscle aches, chills, even nausea, vomiting, diarrhea. So those are all potential symptoms of COVID-19.
Thank you. So how often should you get the test? If you've had it, should you get it monthly? What's your recommendation? Yeah,
so right now I would say if you get tested once, right now, that's enough. If you keep your physical distance, okay, and let's take a half step back. If you're symptomatic, get tested. We have not yet determined any protocol for how frequently you get tested if you test negative. So right now, I'm going to say you get one test. If you test negative and you feel good, in other words, you're asymptomatic, then right now, I would say stay with that. This is June 11th. That may change as of June 12th. So I check these things like every day, every other day. So right now, there is no indication to retest. Now, here's the other thing, though. If I were a barber or someone that is going to be interacting with, 12 people a day, 5 or 6 days a week, I would recommend, and this is me stating, I haven't read anything that says, but I would recommend that person testing more frequently for two reasons. One, for themselves, because they're being exposed a lot. And then number two, for their customer. So, if you go to the barber or the hair salon, you find out a week later that your stylist tested positive based on all the way it works, generally within 48 hours of symptoms, or you find out, that means they've exposed all these people. So now you're worried. So for people that are in high touch, what we call them, I would recommend more frequent testing, and probably every 2 to 4 weeks. But that's just me. I can't quote any source on that.
I know we have so many questions. One last one, I think we have to wind it up. What is herd immunity? If all healthy people get COVID-19, will it become less lethal when coming back in contact with vulnerable populations, or will the virus still be deadly to vulnerable populations?
Yeah, so that's a great question. So herd immunity means that 92 to 95% of the population is immune. So if we have 100 people in a room and someone has it, that means that they can't spread it. They can only spread it to someone who is not immune. So if it's, say, 95%. So if you have 100 people, there are only 5 people in that room that can get it. And then if one of those people get it, they can't spread it. So if you're, though, at 20%, one person in that room has it, that means 80 of those people are susceptible and they get it, then they spread it and spread it and spread it. So that's what a vaccine confers. It confers herd immunity. So it protects that 5 to 8% of people who are susceptible because it's not circulating as much. So the way we will get to herd immunity, other than having 3 or 30 million people die, is through a vaccine. So if it spreads throughout so I'll leave it at that.
I'm sorry, Dr. Brooks, I didn't mean to cut you out. Because we started a little late, we're going to go over time, so you can ask 2 more questions.
Well, thank you so much. This
You're
is
welcome.
a question about realtors showing properties. Is it safe for us as realtors to go into a home and let's say the homeowner has COVID while wearing a mask and gloves to help reduce the exposure to the virus?
So that's a really, really good question. Again, indoor environments are not the best environment in which to be interacting. Okay. The owner lives in the house. Is that what I'm hearing too?
Yes.
So then my feeling is I would want that owner out of the house for, I'm going to just say 24 hours. Right now, we don't really feel that it lingers in the air. So if they're out of the house, then whatever was in the air is gone. Then everyone would have to wear a mask and glove, because it's obviously most of the surfaces will probably be okay, and it tends to stay on smooth surfaces. Like it's more likely to linger on a countertop versus a bedspread. So if you wipe down everything, have that person out for a day, I probably, and honestly, there might be full disclosure, let them know. This is, I don't know if I have to think about that one, but that might full disclosure say, these are the precautions we took. Then my feeling is it's probably okay. I mean, honestly, it doesn't linger for a day in the air. So if you're gonna have an open house on Sunday, ask the person really don't be home on Saturday, and then wipe down the surface yourself, and everyone just say gloves and wears masks. And if you want to even think about that, just have that as a policy. So if you don't disclose it, which you probably don't have to, because ultimately if someone really caught it, they couldn't pin it on you. That's the one thing that'll be interesting. How can you say, I got it from that open house? I could say you got it on your way to the open house or when you left the open house. But I would say as a general policy, have people mask and glove when they go to a house, and you mask and glove.
Thank you. You wouldn't believe we have 30 questions, but we won't get to all of them. Could a person be a carrier that has COVID and not be affected, however, it infects others? So they've been a carrier, and they carried it to others, but they never even got sick. So
that's, again, it goes anywhere from 25 to 40% of people that have COVID don't know it, or they have no symptoms. So what you can get is what would be considered, I wouldn't even call it a mild case. It means that it's in your system and you can theoretically spread it, but your immune system is effectively fighting it off to the point that it has not caused ultimately a lung disease. What happens is it goes down into your lungs, it gets on the lining of the inside of your lungs, and it causes damage. That's what kills you. So let's say it's in your system, but it hasn't gotten down into the very depths of your lungs and affected enough of your lung field to cause true symptoms, low oxygen, fever, cough, shortness of breath. You still have it, and you still are expressing it out in your breath distance is what I call it. So that can happen. That's why not having symptoms doesn't mean you don't have it. And you call it a carrier, it's an interesting term, but it does go away. Technically, we don't call that a carrier because a carrier keeps something for years. This you won't keep for years. You'll just be asymptomatic, but it will go away. That person will clear the virus.
So, doctor, does that mean if 2 people both are wearing masks but they're not 6 feet apart, that they could, and one may be infected but didn't know it, they could spread the virus to each others or others around them?
Yeah, underscore the yes to my answer of that. And that's the whole problem. That the feeling right now is that masking isn't enough. In other words, that social distance. You don't hear people say either mask or stay 6 feet apart. It's mask and stay 6 feet apart. So do understand that. I believe that the mask does help. So that's my saying. Like when you go, if you end up going to the salon, hair, nail, salon, barbershop, that you are breaking that 6 foot distance, but that mask does help, but it's not 100%. So yes, I mean, two people within 6 feet, both masked and both asymptomatic, but one is, as you called it, a carrier or has the virus, that there's still the potential, but it's a lot less. So now you get into a matter of degree. And what, you know, these are difficult questions. These are difficult times.
Doctor, when you were talking about on the airplane to wear, cover the eyes, you said you recommended sunglasses. So others are asking, could their regular eyeglasses?
Oh yeah, no, yes. I just said sunglasses. If like I'm looking at this, none of y'all have on glasses. So I wear glasses because I need them to correct my vision. So you could also get, you know, clear glass, but I mean, all of you own a pair of sunglasses. So I'm just saying, wear something, you know, wear goggles. Your ski goggles is actually probably the best because it protects on the sides too. But it's like someone coughs or breathes, it hits your glasses as opposed to the mucosa or the lining of your eyes. So no, just something covering your eyes.
So I see now that the people have these little plastic shields that you can put like a headband to just cover any, and a mask underneath. So that's just covering anything from getting in.
Yeah, I would still wear a mask with that, but yeah, absolutely. Yeah. That's the best. That's what generally either goggles or that is what I will be using when I go out and see patients.
Gotcha. Have we run out of time yet, Jill?
One more question. The president approved one more question. Yeah.
Okay, the last question that we'll have is this, and this is a good one to go out with, I think. To be clear, if we are gargling with hot water and salt and drinking garlic, ginger, and hot pepper teas, will that help?
Not really. I hate to say. I mean, it might get your chance down from 1 in 200 to 1 in 199 or something, but no. Again, once that virus gets this is a deadly, dastardly virus. Once it gets into, as soon as it hits your respiratory tract, it burrows into the cell. So that lining, what you're thinking about is cleaning off the lining of your respiratory tract with gargling and hot water and garlic, but it's inside the cell. It doesn't spin. It doesn't hang. It will come out of the cell to spread, but once it gets in there, it's in there. I mean, it's no. I mean, you can do that, and it may afford you some psychological comfort, but no. The best thing, clearly, quite frankly, is don't get it. Okay.
Okay. Well, doctor, you took away, putting on my orange peels in the water, boiling the water, and putting my head over the water with a towel. You just took that away from me right there.
Right. I mean, I just can't recommend. There's no data to show that works. Sorry. I would say just focus on your mask, wearing, washing down surfaces, washing your hands, staying 6 feet away from people. That's where your mind really needs to be.
Well, thank you so much. I mean, we gave you a barrage of questions for the last 30 minutes, and you just went along with it. We appreciate your time and your willingness to share your knowledge with us. I think that I tried to capitalize. Some things were repetitive. And so one last question. What foods and drinks do you recommend that we should use to strengthen our system, or foods that may weaken our system? Do you have our immune system?
Yeah, so, I mean, there's a general feeling that sugar is not good for your system. For your immune system, again, I mentioned, I do believe, and I did a lot of reading on it, I do believe in vitamin D, so I want to stress that. vitamin D gets develops from sunlight hitting your skin and converting 17-hydroxy cholesterol into vitamin D2, and then but in other words, you need sunlight, and so darker people, the sun doesn't penetrate. So I would start with that. I mean, if you do that one thing, and then generally a healthy diet. Vitamin C is felt is an antioxidant and has some antiviral properties. So there is some feeling that vitamin C, 1,000 units, 2,000 units, 1,000 to 2,000 units a day is good for you. So I mean, I'd say vitamin C and D. So if you're really on that health side, start with that. And then a healthy diet, fruits and vegetables. Minimize your meat. And I would kindly, and then there's some feeling about green tea. Green tea has antioxidants in it. I drink green tea every day, but that was long before COVID-19. I take my vitamin C and D every day and a multi. But I just try to eat healthy. And then again, we won't try to stress out Mr. Williams when he comes and say, you know, about that down payment I was supposed to get for you, you know. So try to keep the stress in your life low and try to keep the meditation and the positive thoughts high.
Doctor, because you talked about vitamin D, so important. I definitely myself you started using that. COVID made me become healthier, but someone asked if we look at natural synthetic vitamin D versus any other kind, or you have recommendations on the type of vitamin D?
Go to your drugstore and go to the Safeway brand or the Costco brand vitamin D. You don't need any. It's when it gets inside your body, the body can't figure out that it was from some guy on TV that sold the good stuff. And 2,000 to 4,000 units, generally speaking, a day. It's good if you can get your vitamin D level checked, because if your vitamin D level is low, you actually might need more. And there is some thought that the levels that they say are normal for people are low. So somewhere probably around 40 is a better level than 20, though 20 would be felt to be normal. And again, African Americans, we have higher rates of low vitamin D.
So we have as a wrap that we can take 1,000 to 2,000 units of vitamin C, 4,000 units of vitamin D, any brand. For our mask, the N95 mask is the best. We need to exercise, eat well, fruits, vegetables, fish, chicken, use green tea, and keep our stress down, try to relax as much as possible, clean our surfaces, keep our hands washed, and the like, and just live healthy, basically, and that will help us.
And infection
to
control.
fight this virus. And distance.
Yes.
All right. Take it back, Mr. President. Thank you so much, Doctor.
Thank you.
My pleasure.
Thank you very much. Thank you very much, Dr. Brooks. We appreciate you. Michelle, thank you so much. Jill, I believe we have a trivia question. Am I correct?
We do.
Okay, great.
Thank you. My goodness, you gave us more than enough information. I don't know if there's such a thing, but thank you so much. But our trivia question, our current president, P31, the 31st president of the National Association of Real Estate Brokers, has a slogan, motto that he came into office with, and we want to know if you've been paying attention. So the answer to this trivia question should be emailed to narab@narab.com. And the question is, what is President Williams' slogan, motto for NARAB? And the winner, the first person to email narab@narab.com will win a special door prize.
Okay, thank you very much. I don't believe I have any people to thank, but I do want to thank Jill. I want to thank Amon. I want to thank Ruby. I want to thank Miss Little on helping put this on. I know it's hard work. I want to thank you all. I want to thank Michelle Calloway, my chair, my executive director, Mr. Thompson, my chief of staff, Bill Collins, for helping us here today. And let me see here who I have here. I have some RVPs on the phone. Thank you very much. Oh, I want to thank my first Vice President, Lydia Pope, for saying the prayer. I want to thank my RVPs I see here, Mr. Petrie, Texas, my Ronnie Smith, I see here from New Jersey. I see Madam Henry from Georgia. So those are the only ones I see right now. And of course, I want to thank my local board presidents and each and every one of you, because we're here to give you information. I need you to hold on to it. I need you to take it back to your members, because NAREB is at a chance, at a point in time, after all these years, where we need to pivot. And we are pivoting. We are embracing change, and we're going to act. This civil unrest that went on, we didn't just give it up. We didn't. It's not over. It's not over. This is not a skirmish. This is a long battle. Okay, this is not a sprint. This is a marathon. All right. So hey, I thank you all so very much, and have a good day.
Mr. Williams.
Yes.
We want to pivot with you. So let us, between you, Ms. Calloway, and you, I want to keep the lines open between NAREB and the NMA. Okay?
And that's what I wanted to hear, Doctor. We have this great system coming out next week called the referral network. So we want to match your doctors up with our realtors. Okay, so we are impacting the world, and we want you to join forces. So I thank you so very much for even coming up with that. Thank you.
Thank you.
See how good God is, people? The last shall be first, and the first shall be last. Bye. Good night.